Every morning, along these foggy shores, an ancient ritual unfolds.
For millions of years, the horseshoe crab has patrolled these shores. Today, its unique biology is saving human lives.
Inside the horseshoe crab industry, how blue blood becomes critical for life-saving medical tests.
Okay, this one is ready.
Got it. Specimen 74 logged. Next.
Brought in from the wild, the horseshoe crabs are held in these specialized tanks. Here,
Maintaining the precise temperature and oxygen levels is critical for the horseshoe crab's health before their blood can be collected.
from the tidal flats to this state-of-the-art facility, the journey of the horseshoe crab is essential for life-saving medical tests.
Once collected, the crabs are transported to secure facilities like this one, where their vital blue blood is carefully. These ancient mariners are vital to modern medicine. Upon arrival at the lab, they are carefully transferred.
Okay, the shell health is excellent on this one.
Yeah. Measuring at 12.5, ready for the tag.
Once safely transported from the shore, the crabs are meticulously prepared in a sterile environment before the crucial bleeding process begins.
This remarkable creature yields the vital component for global health safety. Its copper-based blue blood is carefully extracted for medical testing.
The secret lies in their remarkable blue blood, the foundation of a multi-million-dollar industry critical for modern medicine.
Horseshoe crab blood is essential for testing the sterility of medical equipment. Here, we see the careful preparation required for a safe extraction.
Before the blood can be drawn, the shell surface is meticulously cleaned with an antiseptic solution, ensuring a sterile and ethical procedure.
The needle is carefully inserted into the cardiac sinus. The blue blood, or hemolymph, is then slowly
At the molecular level, we see the hemocyanin protein. The key component is copper, which
The alarm's just cleared. We have a green status across the board.
Confirmed. Proceeding with transfer.
To protect the integrity of the Limu's amoebocyte lysate, or LAL, the samples are quickly transferred to a
Look at the spike on the mass spec reading here.
Yes, the contamination levels are fluctuating again.
The horseshoe crab's blue blood is critical. These samples are now moved to the lab, where they become vital for life-saving medical tests. The horseshoe crab's blue blood immediately forms a clot when it encountered endotoxins.
When the lysate detects endotoxins, it rapidly transforms into a semi-solid gel. This is the critical LAL reaction at work.
Using the Limulus amoebocyte lysate, or LAL, technicians can detect dangerous endotoxins on
This remarkable blue blood, rich in Limulus amoebocyte lysate, is essential for validating the safety of medical equipment.
Inside this sterile environment, the raw LAL is purified, ensuring that life-saving medical devices are free from contamination.
Isolating the clotting proteins is a meticulous process. The purified LAL reagent is critical for testing.
The purification columns are essential. The blue lysate is meticulously processed to isolate the endotoxin.
This sophisticated filtration system is critical, guaranteeing the unparalleled purity of the Limulus amoebocyte lysate.
Inside the lyophilization chamber, the frozen blue reagent undergoes sublimation, transforming directly into a stable.
This fine powder, derived from the horseshoe crab's blue blood, is the critical component in life-saving medical tests.
This blue blood product is critical. The purified LAL is now ready for global distribution.
All right, deep breath in. You're doing great, almost done. We need to validate the synthetic assay against the control group.
The current batch shows too much variance. We should try the alternative protocol.
While the demand for the life-saving LAL test grows, scientists are working to ensure the sustainable bleeding and release of these vital creatures.
After their vital contribution to science, these remarkable creatures are carefully transported home. This ensures the survival.
Look at this reading here. It's inconsistent with the previous data.
Yeah.
Let's double check the calibration before we log it.
The signal is strong, heading southeast.
Looks like he's settling into the deeper channel already.
The data is encouraging. Studies show a post-release survival rate of approximately 95%.
The industry relies on this resilience. Thankfully, most crabs survive the process. Their blue.
From the tranquility of the coastline to the cutting edge of medical science, the horseshoe crab remains a vital.
The debate continues, balancing the survival of the species with the urgent need for medical safety. But alternatives are on the horizon.
If we adjust the parameters here, the toxicity levels drop significantly.
That solves the delivery issue for the alternative method. Let's run that simulation again.
This side-by-side comparison highlights the future of endotoxin testing, moving away from reliance on the crabs.
By utilizing synthetic reagents, these advanced systems provide the same critical safety data without impacting marine life.
The pharmaceutical industry is embracing sustainable alternatives, ensuring the future of medicine and the protection of the horseshoe crab.
The future of medicine and the fate of the horseshoe crab are intertwined.